Good morning, friends. Today we are going to talk on one of the most important topic, that is a biting in a child. So many parents are worried and they are concerned that their kids they do bite, and that cause a lot of embarrassment in them, and they don't understand what is happening. So friends, biting in children is a very common phenomena, and here in this video I am going to explain you what biting is and why does a child bite. Does biting is a pathological phenomena? Is it a behavioral disorder, or it is quite normal for a child to bite? So friend, in this video, what we are going to understand is we are going to understand the causes of biting. Why does a child bite? Why does an infant bite? And what are the exact reason a child bites? So friends, biting is primarily the main cause of biting can be two. Either it is physiological or it is pathological. When we talk of physiological, it means that this is quite normal biting. This biting in children is quite normal, and only you need to reassure the kid and just soothe him so that this biting is taken care of. Whereas friend, when we talk of pathological biting, pathological biting is because of some problem in the child. It is more so connected with a behavioral problem in the child, and you need to address the behavioral problem. You need to address the cause in such children to help children bite, prevent biting. This pathological biting is because also of a defense of the child. The child has got lot of needs, lot of inner frustration, anger, and they remove this by in form of biting. So friend, physiological biting is quite normal. It is also the child wants to explore the teeth, the child puts things in the mouth, and this is quite seen in between the age of 6 months to 2 years. So when the child, when the infant or the toddlers is from 6 months to 2 years of age, they have lot of sensory needs, and then they try to explore the world. And the most important point for exploration of world is to explore the world through their mouth. So we'll take things, put things in their mouth, and that is considered as a physiological biting. Also, a toddler, when their dentition, during their dentition time, when their teeth are erupting, they will put things in their mouth, they will bite things softly to soothe their dentition. Whereas pathological biting, usually it is because of their internal emotional feeling, and quite commonly seen between age 1 to 5 years of age, when they have their emotions develop. So friends, why does a infant or a toddler bite, and what is the meaning that he explores the biting? So friends, during dentition, the child, the toddler has got lot of irritation around the mouth, and he takes hold of things, hard things, to soothe that pain, to soothe that difficulty of dentition. In such cases, friends, what you have to do is you have to give some teethers to the child so that he can bite on those soft things and he can soothe his irritation in the teeth. So in physiological biting, what we see is that there is either they are trying to explore the surrounding, or they are teething. So for teething, what you do is you give them some soft substance to bite, also called as teethers. Now friends, when we, what are the expressions of this biting in a child? Physiological, so they are called as mouthing, like putting things in the mouth, and it is also called as biting object to soothe their dentition. So these are the two major expressions of physiological biting in a child. What do we mean now pathological biting? So friends, toddlers many times they are frustrated, they are angry, and to express their anger, express their frustration, they start biting. So it is frustration, anger, or even excitement, the child starts biting. Or sometimes the child feels very insecure of his environment, that will also lead to biting. And sometimes the child is very attention seeker, and to seek attention, to get attention, again the child starts biting. So what are the feelings and what are the expression of pathological binding? So friends, first expression is the child when he is angry, he'll start biting. So the child is angry about certain things, the child is angry about certain environment stimulus, the child is angry on something, and the child will start biting the person on whom he is angry. Second thing is, if the child starts feeling insecure, unsafe, insecurity is there, again the child will start biting. Now here there is a difference between biting when the child is angry and biting when the child starts feeling unsafe. And the third thing is that if the child starts to seek attention, again the child will start biting. As you can see in this child, the child now starts to seek attention and he'll start biting. So friend, what are the differences? How will you different the biting when the child is either angry, the child is insecure, or the child needs attention? So friend, when the child is angry, the child starts biting, and it is a vigorous, is a strong bite. It is with a force, and it is usually directed towards the source of anger. It is forceful biting directed towards the source of anger. The child will clench his teeth tightly. Friends, if he is feeling insecure, that time it is little, the child is little timid, the child is little fearful, and he is seeing around, seeing in the surrounding, and he will start biting. Here the bite is not with force, but it is an hesitant. He is little defensive and he starts biting. And friend, lastly, the child will start biting to seek attention. Here the most important difference which you will find is that after biting, the child will look at you, smile you, and will be happy to get your attention. So this is a, here there is a playful biting to the child, to the caregiver, or to the parents. So this is the basic difference between biting when the child is angry, when the child is unsafe, feels insecure, or when the child needs attention. So friend, this is very important for every mother to understand the reason behind the biting. And once you understand the reason behind the biting, you can address the problem, and the child will be better, the child will soothe himself. So just to recap what we have talked in this video, is that there are two type of biting. There is a physiological biting and a pathological biting. Physiological biting is when seen usually in toddlers, usually seen in infant, when either due to dentition or due to the need to explore the world. So they will bite. Now this bite is very soft. It is not a painful bite. Or the child will just put things in the mouth, which is also called as mouthing. Whereas pathological binding is a problem, it's a behavioral problem in the child, where the child bites because of three main reasons. Either he is angry, or he is insecure, or he needs attention. The difference between the child who is angry and attention seeker is, the child when angry will bite with a force and will show his anger, clench his teeth. Whereas when the child bites to attention, for seeking attention, he will bite and then observe your reaction, and he'll be happy, or he'll be a mischievous smile will be there after the child starts biting, and then he will look at you. So that is the basic difference between the child when he is angry or when he is seeking attention. And an insecure child will be looking around cautiously, hesitantly around the environment and bite if you try to approach this child. Friends, I hope this video explains in detail about what biting is and how to differentiate biting in an infant and a toddlers. In some other video, we'll also talk now how to resolve. Suppose you have a child who is biting, then how to help this child to resolve his problem of biting. I hope you enjoyed watching this video. In case of any other doubt, feel free to contact us. We'll be guiding you in various behavioral disorders of your children. Thank you very much.